Okay, folks, it's a different type of dentistry, and we're talking biological dentistry with Dr. Sam Glick. And Dr. Glick, I've been waiting for this segment for 2 days. I knew you were coming. So what is biological dentistry?
Yeah, thanks for having me here.
It's great to have you.
Yeah, shout out to my family, my little kiddos, and my wife at home.
There you go.
Sloan and Silas, hi. Biological dentistry is a holistic approach to oral health that considers how dental treatment affects systemic health, affects the entire body. So in my offices, we try to take care of our patients, not just focusing on the oral cavity, but how it can affect the rest of their health in the long term.
I see a lot of different commercials for dentistry, and some of them are talking about complete renovation, some partial renovation, prevention. Where does it start with you, and what's most important in your practice?
Yeah, absolutely. We do pretty much everything in-house in our dental practices, from full mouth rehabilitation with extractions and dental implants to the basics, you know, your cleanings and keeping teeth healthy. One thing that I always tell patients and recommend as it relates to biological dentistry is removing their old silver amalgam fillings, getting the mercury out of their body. So from simple to as extreme as it gets, we do everything for our patients.
How big a deal is that? I mean, you're talking about patients that would have those old kind of fillings would be what, like 50 plus, 40 plus years old?
You know, unfortunately, we've even seen that military, you know, still does mercury amalgam fillings, so they can be put in more recently, and there's a lot of people that can have health effects from that, especially if they have a metal sensitivity.
What are some of the effects? Like somebody might not even notice because they've been putting up with it all these years.
Yeah, drowsiness, you know, brain fog, those things.
Oh, I got both.
Yeah, right. We all do. A little coffee helps sometimes, but no, in the long term, you don't want to have that mercury in your body for those obvious reasons. So.
And we use the term biological dentist. How should that make like middle-aged or older people who are looking for a new dentist feel better about coming to see you and your method of practice?
Yeah, it tells you that when we do treatment in the mouth, we're considering how it can affect you systemically, right? I don't want to put something in your mouth like a titanium dental implant if you have a metal allergy, right? There's other options we can consider. So that would just be one example. But some dentists just focus narrowly on the mouth as a isolated system, and we don't want to do that.
How would that metal allergy present itself? How would you know?
Again, drowsiness, you know, brain fog, but also it can lead to inflammation in the body, you know, joint issues, you know, different pathology in the body that way.
Great.